I'm Justine Heneo. I'm a physician at Northside, Forsyth, and don't start the timer yet. Okay. I was going to give you more of my bio, but I don't want to take time away from my presentation. So, vaping. So I'm here to tell you a little bit about vaping. E-cigarettes are alternative, non-combustible tobacco products that generate an aerosol. So it's not a vapor, it's actually an aerosol. It contains nicotine, flavors, propylene glycol, vegetable glycerin, and many other chemicals, including carcinogenic chemicals and other compounds like metals, which include tin, lead, nickel, chromium, manganese, and arsenic. E-cigarettes appeal to current smokers, former smokers, and more importantly, young people that have never smoked. E-cigarettes reach the market without either extensive preclinical toxicology testing or long-term trials, and they are currently not regulated by the FDA. E-cigarettes, I can't see that far, so. It is highly controversial right now if they are safer than regular cigarettes. It is not proven, it has not been tested to be safer than regular cigarettes. Their effectiveness in smoking cessation is also highly controversial. A lot of people that vape are dual users or switch a smoking habit to an e-cigarette habit. Please, this is one of the most important things I'm going to say. Decades of chronic smoking are needed for development of lung diseases, such as cancer and COPD. So the population effects of e-cigarette use may not be apparent until the middle of this century. Here's a graph. On the left side, it shows, I wish I had a pointer. In 2011, the blue, on the left is cigarettes, on the right is e-cigarettes. 15.8% of high school students used e-cigarettes in 2011. That decreased to 5.8 in 2019 with all the education, all the Truth Initiative commercials, showing people with trade tubes, there was increased education. Now with e-cigarettes, in 2011, 1.5% of high school students used e-cigarettes, and now it's climbed to 27.5% of high school students using e-cigarettes. 1 out of every 4 students in high school vapes. And that is much higher than the 15.8 that used regular cigarettes in 2011. So what acute illnesses are we seeing in the hospital due to vaping? There has been a significant increase in collapsed lung admissions. In the last 2 months, one of the pulmonary groups saw 4. I've never heard of it at Northside seeing a kid with a collapsed lung. It was very rare for us. Second one, EVALI, which stands for e-cigarette or vaping product use associated lung injury. I'll talk about that a little bit further later on in another slide. 3, could new onset seizures in teens be caused by nicotine overdose due to juuling? We've also had increased seizure admissions. And of course, exacerbations of asthma, high increase of asthma exacerbations all across the country. Bronchospasm due to vaping. Another thing is popcorn lung, for example, but I'm not going to talk about that today, but that's another thing that e-cigarette use can cause. So first, pneumothorax, which is collapsed lung. It occurs when air leaks into the space between your lung and the chest wall. This air pushes on the outside of your lung and makes it collapse. The lung is basically made up of bronchioles that have air in them. Inflammation and lung injury created by the vaping, by the chemicals, by the heat, creates blebs that can rupture and pop like a balloon. This air inside the bleb leaks into the space between the lung and the chest wall, and this air pushes the lung and makes it collapse. Here I have an image of what a collapsed lung would be. All that empty space is basically the air pushing the lung. When your lung is collapsed, you can't breathe. You can't get oxygen into your system. On the other one, it's a teen, an actual teen seen at Northside. The one on the left, if there's a faint green line that shows the space of air pushing the lung. The second X-ray shows the chest tube, the pigtail that has to be inserted to basically drain all this air out and hope that the lung reinflates, basically. This is another picture. It shows the chest tube, how it would be in the space where it has air, and then an actual picture of a chest tube in the wall. This is a pneumovac, which is a device that basically suctions and drains the fluid out. At times, sometimes it works and the collapsed lung reinflates. Other times it doesn't, and you have to go to surgery and get staples, talc, in order to reattach that lung so it doesn't continue to collapse. Oh, no, I was talking about that. Yeah. Sorry, that was, I was looking at my slides. That's the pneumovac that. So, EVALI, e-cigarette or vaping product use associated lung injury. 1,604 cases as of October 22nd associated with e-cigarette products in 49 states. According to the CDC, that's an increase from the prior week, which was 1,479 cases of vaping-related lung injuries. That number is amazing to me. 34 deaths due to vaping, and the youngest being 13 years old. People with lung damage from vaping, the symptoms start days or weeks before, and it just slowly worsens. They develop coughing, chest pain, shortness of breath, nausea, vomiting, some cough up blood, diarrhea, fatigue, fever, weight loss, and they just slowly get sicker and sicker. Out of the cases, the 1,604 cases, 78% reported using THC-containing products with or without nicotine. 37% reported exclusive THC, and 17% reported exclusive nicotine-containing products. The specific chemical exposures causing these injuries has not been identified. The CDC recommends to refrain from using e-cigarettes. The pathology, there were lung biopsies taken from all these cases, and they show different cellular changes. Some lipoid pneumonia, hypersensitivity pneumonitis, alveolar hemorrhage. So all these are terms that are medical, but they're all different cellular changes, like 7 or 8, where you don't know which chemical caused it, which combination. So really, we don't know. People that say it's definitely THC, no, we don't know. We don't know what it is. It could be a combination. There's a study that, well, I'll get to that, that says the toxic fumes from mixing the flavors with either THC or in the e-juice could be causing these toxic fume burn-like injuries in your lungs. So here it is, toxic fumes being formed from the combination of chemicals being heated in the e-cigarette, causing toxic fume burn-like injury in the lungs, causing excessive inflammation and cell death. So when all these cells die, they have to go somewhere, so they clog up your bronchioles. So when your bronchioles are clogged up, you can't get oxygen into your cells to take to the rest of your body. So you're suffocating. In some cases, patients have to be intubated. So this just shows a regular intubation, and you're attached to a vent, and then the vent bleeds for you. This is a chest x-ray, normal on the left, abnormal on the right. All that dark area, that's the way your lungs are supposed to look. All that dark, nice space. The little bit of white you see are vessels. The one on the right, that's EVALI. When in these cases, they've gotten so severe that these teens, the ventilation isn't enough, the intubation. It's not enough because there's so much cell death and your bronchioles are clogged up. So then they have to be sent to another hospital and be placed on ECMO, Extracorporeal Membrane Oxygenation. This is basically dialysis for your lungs because the ventilator doesn't work. It can't push air into something that's clogged up. It can't push oxygen. So blood is taken out through a machine, oxygenated, and put back into your system. When teens come out and they've had to have ECMO, their lungs don't ever get back to normal. There's cases of teens that have lungs of a 70-year-old with COPD and on chronic oxygen because you don't recover from this. There's direct evidence that e-cigarettes cause cancer. There's a study from NYU that exposed mice to e-cigarettes 4 hours a day for 5 days a week for 54 weeks, and they found lung cancer, 22.5%, and bladder hyperplasia, which is abnormal cells, precancerous cells, in 57.5% of mice. And usually in the bladder, you see cancer changes because that's where your body tries to get rid of all the toxins and they go through your bladder and they collect there. So bladder cancer is associated with smoking, with toxins that your body's clearing. So they basically showed that e-cigarette nicotine induces lung adenocarcinoma in mice. It is likely that the small size of the e-cigarette aerosol allows the nicotine in the e-cigarette aerosol to penetrate deeply into the lung tissues, inducing DNA damage in bronchoalveolar cells. So with the vape, it heats it so high and the compounds are so tiny, there's more absorption into the lung tissue than regular cigarettes. But again, more studies, more time is needed for a scientist to get up and say, yes, 100% definitely. Recently in the CHEST conference earlier this month in New Orleans, a case was presented that a patient developed granulomatosis after 2 months of vaping. Granulomas are basically masses of inflamed tissue that usually occur in reaction to an acute inflammatory event. These granulomas are created from your immune response that's abnormal. It's trying to respond to all this damage and injury. These masses can kill healthy lung tissue and reduce blood flow to the organs. So now a little bit on nicotine. Are vapes and e-cigarettes causing seizures in kids and young adults? This is very hard to study or to diagnose. Currently, we're not checking nicotine levels in the emergency room. It's a hard test, it's a send-out test. It can clear pretty easily from your system. But I'm talking to several hospitals to see if they'll start checking quantitative nicotine levels in the ER with kids that present with new onset seizures. The FDA is currently investigating 127 reports of people suffering seizures and neurological symptoms after using e-cigarettes. And the reason I bring this up is because in the e-cigarette, there's higher nicotine levels than regular cigarettes. There's also a higher absorption rate. It's also easier to use. So you're gonna hit your vape quicker and more times than a regular cigarette because you can do it anywhere. You can do it in your room, you can do it in the movies, no one's really gonna smell it, your parents aren't gonna find out. So kids and adults are getting a lot more nicotine. Some kids, usually like when I admitted a patient years ago and they said they're a 2-pack a day smoker, that takes a long time to get 2 packs a day. Currently, 1 Juul pod is equal to a pack of cigarettes. So kids can go through a Juul pod. So these teens are getting high doses of nicotine very young, at 14, 15, 16, and the absorption rate is higher than nicotine. So what is too much nicotine? When is it too much? And is it causing these symptoms? And all this nicotine is affecting their developing brains, their developing organs, everything about them. So the teen brain is under construction. Basically, when you're a teen, up until the age of 24, and some people the age of 30, The brain, basically what you study, if you like music and you go to concerts, that part of your brain's gonna develop more synapses, it's gonna light up, and then other parts of your brain, let's say you don't enjoy reading, it's gonna start like dying down, the synapses are gonna stop. So that's what happens in your teen years. So nicotine, you're putting nicotine into your body, it's reaching your brain within 10 seconds, and it's affecting the part of your brain that releases dopamine, which is a neurotransmitter that increases pleasure. So when you, as a teen, start using that dopamine and needing dopamine to increase your pleasure, you're always going to need that dopamine. And that's why it is it primes your brain for drug-reinforced behavior in the future. Maybe nicotine won't be enough next time. It will lead to other things. When the nicotine doesn't do it, you're going to need to increase that dopamine. We all need it. Some people do it with hiking, some people do it jogging, some people do it with nicotine and other drugs. Once teens fall into the depths of addiction, it is harder for them to recover. People whose descent into addiction came later in life have more memories of what life can be like without addiction. This is why teens should not be vaping nicotine or any other substances like THC, CBD oil, or illicit drugs, which the lungs are not built to inhale. Teens are nearly 7 times more likely to vape nicotine than adults. These are all facts. Marijuana vaping among youth has increased by 58% in one single year. Kids 15 to 17 years old are 16 times more likely to use Juul than older age groups. Flavors mask the harsh taste of tobacco, which makes it easier for kids to smoke it. And most kids don't know that flavored e-cigarettes are high in nicotine. Kids are also using the flavored nicotine and mixing it with their THC oil. That decreases the odor, and it makes it more palatable, and it smells good, and they can be doing it anywhere. All these vapes could also have THC in the school bathroom. They're just mixed with bubble gum and watermelon, or I think there's unicorn poop out there. So currently there's 15,500 flavors. The tobacco industry is hooking the next generation of addicts and flavors in a big way. 4 out of 5 kids who have used tobacco started with a flavored product. The flavored product makes it easier to inhale deeper, and to enjoy it, and it smells good, and it's cool. Nicotine withdrawal in high schools. When I was growing up, I was flabbergasted when I heard that there's nicotine withdrawal right now in high schools. I've never seen that before. And kids are undergoing nicotine withdrawal in the classroom when their vapes are taken up, if a teacher sees them and takes them up. It includes sweats, irritability, frustration, anger, anxiety, and tremors. The percent of high school students who used e-cigarette in the last 30 days increased from 1.5% in 2011 to 27.5% from the prior, if you remember the graph I showed first. 5 million middle and high school students are current e-cigarette users, an increase of 3 million between 2017 and 2019. The use among 8th grade students has more than doubled. 8th grade students who use e-cigarettes are 10 times more likely than their peers who do not use e-cigarettes to eventually switch to tobacco products, to regular tobacco. Adolescents and teens who use e-cigarettes are likely to become regular tobacco smokers as they get older. And there are studies and data to prove these points. This is a picture of teens vaping in the classroom. We need to help get it out of high schools. Where younger students, there's actually currently high school students that have the legal age to purchase them. And that's how it gets down and it trickles down. There's actually students in high schools that sell them for a profit. They can find them at parties, they can share them. A 2015 report by the National Academy of Medicine concluded that increasing the tobacco sale age to 21 would improve public health and have both immediate and long-term benefits. That's just proven, it's data. Here are some ads. The e-cigarette industry is copying the same thing that the tobacco industry did years ago. Here's that it's healthy. Everyone thinks that is saying that vaping is healthier now. This is an old ad from Camel. This is a new ad from today. More doctors vape than use traditional e-cigarettes. An old ad for Lucky Strike, an e-cigarette ad from today. An old ad, that's a cute baby. Why quit, switch to blue. They don't even want you to quit. People think, oh, it's to quit. No, it's not FDA approved to quit. There's things that have been studied for you to quit smoking cigarettes. And this has not been studied or approved or FDA regulated to do any of that. From 1988 to 1997, Camel targeted kids with a hit cartoon character, Joe Camel, that significantly boosted the brand's market share among youth smokers and became nearly as recognizable to 6-year-olds as Mickey Mouse. This is a current Juul ad, cool, hip, happy, she's in bliss. Back to school blowout sale for vaping products. Kids are being targeted with ads, flavors, and sleek, modern, easy to conceal devices. So I like to think of it as these circles. There's always going to be a percentage of kids that are going to smoke. They're high risk, whether their parents smoke or trauma or whatever the reason is. There will always be a percentage of kids that will pick up a smoking habit. The problem that we're seeing now with e-cigarettes, it's not only attracting the kids that were going to smoke anyway, but if you see the orange and the red, it's attracting kids that were never going to pick up the habit. And this is because it's multifactorial, because of the flavors, because it's an easy device. But a lot has to do with flavors. Because they're cool and they're fun and it's like a great piece of gum that you smell and you want to have. You go into a room and someone's chewing this awesome gum and you want it. So I actually am working with the Vaping Attention to Prevention student organization, and I started, like, what can I do? One of the things that inspired me was this nicotine withdrawals, because it may seem like nothing, but that's a big deal to me. I don't understand why you would have nicotine withdrawals. So I started thinking, what can I do? So I wrote a resolution for the Medical Association of Atlanta, which was fully supported. I went to the Medical Association of Georgia, and it passed. And now we have policy that was just passed 2 weeks ago that the MAA and the MAG support and recommend and highly advocate for tobacco 21 and banning all flavors, including mint, menthol, and wintergreen. Currently, right now, in Washington, D.C., Juul is lobbying heavily to, if they ban all the flavors, to keep mint, menthol, and wintergreen. And 67% of teens enjoy those flavors. So that they will keep that market. They don't want to lose that money. And we can't allow that to happen. I missed a slide. Oh, the most important slide. I'm sorry, guys. It's not in there, but I had a slide that showed the Vaping Attention to Prevention crew that they partnered with Forsyth County Drug Awareness Council, and they have a great ambassador program. They have teens and ambassadors representing from several Forsyth County schools, high schools, from Gwinnett County high schools, from Texas, from Florida, from Boston. Someone from Boston College is a spotlight blogger. So I'd love for you to check out and take a picture of their website and look at it. It'd be great for teens to get involved and represent and try to become an ambassador. The ambassadors go to their high schools, either start a club or with their friends, they will do 4 mini marketing campaigns throughout the school year, every 9 weeks, to make the use of e-cigarettes uncool. So that's a resource for teens to get involved. It's an organization for teens by teens. I also became a member of Parents Against Vaping and E-cigarettes, and I am their paid representative here in Georgia. This is a great organization for parents to get involved. There's going to be a lot going on at the state capitol coming January through April, and we need all the bodies we can get and to advocate for safer laws, safer bills to keep our next generation from becoming nicotine addicts and giving Juul and all these companies all this money when our kids are getting sicker. Thank you.